I think that we could probably get started now. We'll just keep going while people start joining. Then we'll just put a couple things in the chat for them so they know. But I just want to say hello to everybody joining us tonight for our webinar series, Residency Real Talk with Dr. Samir Desai. For those of you joining us for the first time, I just want to say thank you. My name is Alyssa Harlow, and I am the Director of Marketing of MD2B Connect. So I just want to introduce myself real quick. For those of you returning, thanks for joining us again. And we are so excited to have you here with us tonight. We look forward to answering your questions that you'd submitted in the Google form. And due to the large influx of questions that we had, we're actually going to be taking a huge focus on those questions so that we can get to all of them. So we actually won't be taking questions in the chat for the end tonight. However, if you have any questions at the end of the webinar or at any point in your journey, we encourage and welcome you to reach out to us, and we would be happy to help answer any questions that you may have. You are part of our MD2B Connect family, so please do not hesitate to reach out. Our entire team, including myself, is always happy to help you and answer any questions that you have. So throughout the webinar, I will be sharing some useful links and some resources in the chat for you to use. Please feel free to save those and click on them and save them in your browser or whatever you may use. And with that said, we hope that you guys enjoy the webinar tonight. So without further ado, I will go ahead and pass it on over to you, Dr. Desai.
Great. Thank you so much, Alyssa, and a hearty welcome to all of our rotators, wherever you are. Today, as Alyssa said, if you are anywhere near the path of the storm, we wish you that you are safe and sound. We do this webinar to keep you up to date on a monthly basis of things that are going on with respect to the residency application and selection process. What we usually cover in the monthly webinar is related to where we are in the application cycle. In the coming months, starting next month, September and October, November, we'll be focusing mostly on the residency interview. So we encourage you to stay with us as we'll go deep into the residency interview and give you powerful strategies to really impress your residency interviewers. Today, we are just going to take your questions. We invited all of you to submit your questions, and I thought this end of August would be a great time to open it up to all of you, because I've been speaking to many of you individually, and I know that there's a lot of stress, a lot of uncertainty related to how we apply for residency programs and how to put your best foot forward. So we wanted to give you this opportunity in this webinar to ask your questions. And we got so many questions. We usually get lots of questions every month, but I think this month exceeded our question number for many, many months. And I think that's a reflection of just how much you all are thinking about different things. And so what I've done is I've taken your questions, put it together in a PowerPoint slide so we can go through many different topics as it relates to the residency application process. And remember, if you have questions that we don't address here, and they are personal and specific to you, you are always welcome to reach out to any one of our team members. All of you, or almost all of you, have my direct line. So you can always text me if you want to talk, you have a question, you're not sure what's going on, or you just want to give me an update. Don't hesitate to reach out, because in our MD2B Connect program, it's not about just doing a rotation. It's really about us getting to know you, knowing where you want to be, and then providing the support to help you get there. So our program is very much also about mentorship. So don't hesitate to reach out, because we don't want you to feel alone. We are with you in this process, and nothing is going to make us happier than to see you match in mid-March 2024. So let's go ahead and get started. This is going to be all about getting into residency and your questions. We're going to start with impactful experiences. So we received several questions from our audience on impactful experiences. And now this is a section, a part of our ARAS application. It's a relatively new part of the ARAS application. And the question that we received was, who should fill the hardships and struggle section in ERAS? And this section, also known as the impactful experience section, the first thing I want to get across to all of you is that it's an optional part of the application. And we want to ask ourselves, if we need to fill out this part of the application. Everyone is going to have an inclination to want to fill out everything you can in the application, but that's not necessary when it comes to the impactful experience section. So you have to ask yourself, have you faced any adversity? Have you faced any hardships, which are defined as obstacles or challenges on your road to residency? And if you have, then you have to decide whether or not you want to present this in the impactful experience section of the ARAS application. Now, when you're looking at the obstacles and challenges that you have encountered through your journey, a key question to ask is whether it is a major challenge. There are a lot of types of challenges, right? Some major, some minor, and the minor ones may not need to be included here. Now, remember, in this section, we don't want to duplicate content. In the past, before there was an impactful experience section, we would often address these types of hardships in the personal statement itself. And the personal statement itself can still be used as a vehicle to express your challenges and how you grew and matured from them. But now this impactful experience is another place to do that. And if you choose to address an aspect of your background here, it may not need to be addressed in your personal statement. Now, what are some examples of hardships? So you can take some direction from the ARAS worksheet and instructional guide, and they will define hardships as, again, obstacles or challenges, but they may be related to different things. For example, it could be a family health issue. Was there a loved one who was experiencing some type of illness? Was the worst case scenario happen where somebody actually passed away? Have you, because somebody was ill in your family, have you had to change the things that you do? Are you the primary caregiver for that loved one? So all those are examples of family health issues that might be categorized as hardships to address. Some applicants have financial problems. They may come from a lower income family. They may have had to delay graduation from medical school because of an inability to pay their tuition. Maybe they had to work and take jobs outside of their classroom and clerkship experiences in medical school because they had to support themselves and or their family. So those are examples of financial problems. There may have been some educational challenges that people experienced. And of course, there are other life experiences. This is not meant to be an all-inclusive list, just some examples of things that could be featured in the hardships or impactful experience section. Another question we received about impactful experiences came from a rotator who said, can I write about life experience as being first generation and how I overcame struggles and kept pushing until I'm here? One of the great things about our program is that I have a chance to get to know all of you. And I've heard over the years just some incredibly heartwarming and overwhelming stories of how people have bucked the odds and gotten to where they are today. And so an example of that is if you're a first generation student or graduate, you may have faced your own struggles and you've had to persevere to get through all of that to get to the position you are today. So absolutely, this could be something that you write about in the impactful experience section of the ARAS application. And the reason why you might want to feature it, at least one reason, is that we actually have studies that have been done, not just in medicine, but even outside of medicine, that show that first generation students tend to have certain qualities. And those qualities tend to be highly valued by workplaces and residency programs. For example, it may be that you have refined your perseverance, or it may be that you have shown a lot of initiative and proactiveness by being a first generation student. And maybe because of it, you have really developed your emotional intelligence, and now you're also very goal directed. So there's a lot of qualities that come or can come from being a first generation student or graduate, and they may be displayed or shown here in the impactful section. We had a lot of questions about virtual open houses. So let's talk a little bit about these open houses. And one of the questions was, do these residency virtual open houses play any role in interview invitations? So for those of you who may not be familiar with what these are, these are opportunities for you as an applicant to get to know a program virtually. And what I would encourage all of you to do is to connect with programs in different ways. Go to their website, find out, number one, do they have virtual open houses? Number two, how to join those virtual open houses. Sometimes that information is on the website, sometimes it's on their Facebook, could be on Instagram, could be on Twitter. So programs communicate different events that are going on in different ways. So you want to be connected to them so that you are aware of what is happening, and then you can attend these open houses. And in these open houses, they will highlight different aspects of their programs, and it's meant to attract applicant interest. Now, they can cover a lot of different things. Some of the common topics that are often addressed in these open houses include such thing as details about the program, how the program started, how it's evolved over time, how it's changed recently because of the pandemic. So they may go through the history of the program. They may tell you about their different training sites. Remember, a lot of programs have more than one training site. They will tell you about the strengths of the program. You may get some idea from the presentation about weaknesses of the program. You may learn about the hospital. A lot of you are interested in their subspecialty and fellowship placement. That may not be something that they feature on their website, but you may learn about that through an open house. You, of course, will also learn about what their area has to offer, and that's important to all of us, right? What is it going to be like to live in that particular area where the program is? And they may have, as part of the open houses, some Q&As with residents and possibly Q&As with faculty. Now, the question is, do these open houses and your attendance at these open houses play any role in interview invitations? And the answer is yes, because what you can learn from these events can be used to your advantage in the application process, and it can help you get interviews. Now, what are some examples of how you can use information that you gather from an open house to your advantage? So first of all, you attending the open house potentially opens up a line of communication between you and the program coordinator or program director. And that's very, very important. Anything you can do to get closer to the program coordinator or program director is to your advantage. In fact, I recommend that applicants, after a virtual open house, send a thank you email to the program coordinator and program director, because that, again, does the job of opening up the line of communication and shows how well mannered you are and shows your interest. And if you happen to get a response from the program coordinator or program director, now you have an email thread or chain that has started. And later on in the season, when you want to communicate, that is more likely to be received, right, by that program coordinator or program director. It's unlikely to be ending up in their spam or junk folder. And the fact that you're communicating subsequent to that open house in an email chain that you started after that open house reminds them of your interest in their program because you did attend that open house. Now, how else can you use the information from an open house to help you? So not all applicants do this, but you have the ability to write different personal statements. So some applicants have been known to write what we call program-specific personal statements, where some part of the statement is directed at a particular program. And the content that people choose to include in that program-specific personal statement can come from a variety of sources. Well, one of the best sources to use is from a virtual open house. So that is another way that you can use that information to your advantage. You can craft personalized emails, also known as letters of interest, and these can be sent to programs as an expression of your very serious interest in their training program. And in those personalized emails, you may elect to reference something or some things that you learned about their program from that open house. The open house itself can guide your program signal. And you all have seen that these program websites vary in the depth of information they provide. We're all trying to determine how our personal profile as an applicant fits with the criteria of the program. Some programs do an excellent job on their website of listing all their criteria. Others, not so much. In some cases, programs have not updated their information. So going to an open house may get you the information that you need or have been lacking from other sources, and that might guide you to which programs to signal with your limited number of signals that you have to offer. As I said a moment ago, going to an open house or any other residency program event shows programs that you have an interest in their training program. And when we look at surveys of program directors in different fields, we know that about 70% of programs cite perceived interest in a program, your interest in a program, as an important factor in making interview decisions. And of course, when you get that residency program invite, you're going to be asked that interview question: why are you interested in our program? One of the most important questions that you can be asked at a residency interview, and you will have much more knowledge about a program if you've attended their open house. Think again about how sparsely populated some of these websites are. It can be hard to find quality information, and an open house is an ideal way to get the information you need to knock their socks off when they ask you why our program. Another person asked about how can you make yourself memorable at a virtual open house? Now, this can be difficult. For those of you who've attended some of these open houses, you may have found yourself in a sea of applicants. A lot of these events have dozens of applicants, sometimes hundreds of applicants. In addition, the format of these open houses, while they vary, they often involve a bulk of the time being someone like the program director or other official giving some type of presentation about the program. And the way it's structured may offer limited opportunities for you to interact, which of course makes it hard for any individual applicant to be felt as memorable. Now, one of the criticisms that applicants have about these virtual open houses that is becoming more apparent to programs is that they tend to be impersonal, especially when the format is in a large group and is mainly or all a presentation given by a program director. So some programs are starting to leave a bit of time for breakout sessions where they take the larger group and they break it out into smaller groups where a small number of applicants may interact with a couple of residents or a couple of faculty. Sometimes they call these sessions resident meet and greets or resident happy hours. And this tends to allow more interaction because it's a smaller group. So ideally, to make it something where you are memorable to them, you would want to be in a small group setting where they can see you and they can hear you, and that's what gives you a chance to be memorable. Now, what are the do's and don'ts for virtual open houses? Because people were very interested on how to make a great impression. So the first thing you want to do is something before the open house even starts, which is read extensively about the program so that you can get more from your session. Remember that previous slide about what you're trying to get out of the session? That can help you strategically position yourself to get more interest from that program. So you need to read extensively about the program so what they're telling you makes more sense and you can ask better questions. So that also involves making a list of questions in advance to ask, keeping in mind that because there's going to be other attendees, you may only be able to ask a few questions. Now, I recommend that if you're going to ask a question, keep your camera on if the program permits you to do that, because remember what I said in the previous slide, you want to be seen and you want to be heard. That allows you to make the full impact of your camera presence. Now, remember, in a small group session or even in a large group session, if they give you a chance to ask questions, you must be respectful to your other attendees. You do not want to dominate the conversation. You will attend some open houses, some meet and greets, where there's a particular individual who will ask the lion's share of questions. And that is generally not received very well by the residency program officials, whether it's residents or faculty. Because remember, they're going to be looking at you to see how are you going to be getting along with your fellow residents. And so you do not want to dominate the conversation. You have to be careful what questions you ask. So when you make your list of questions, you have to separate out which questions are more appropriate for attendings, which questions are better for residents. And remember, if you're going to be on camera, which you never know if you will be on camera, you need to be appropriately dressed and attired. So follow whatever the dress code is. Generally, it's business casual. So make sure that you are looking presentable. As far as virtual open houses, there's a virtual, obviously, component to this. So one of the things that we have written and spoken extensively about is virtual interviewing. And so in our blog posts and our podcast episodes, we talk about the technology as it relates to your virtual interviewing, and certainly it applies to virtual open houses. So we encourage you to read our blog post and listen to our podcast on virtual interviewing, which you will find not at MD2B Connect, but at thesuccessfulmatch.com, which is our sister website. And you will learn how to use technology that works for you and presents you in the best possible light. We had some questions about letter writers. One of the questions was an interesting question, and it had to do with whether the author's name or title as a fellow of an association does it play a significant role in determining whether an interview invitation is extended. So what they were referring to is a designation that some physicians have as a fellow of one of their professional societies. So for example, in internal medicine, a major professional society is the American College of Physicians. And in surgery, for example, we have the American College of Surgeons. So members of these two societies can apply to become fellows. Now, this doesn't mean that they have done a fellowship. It's just a distinction that is awarded to them from their membership and is earned because that particular doctor has made an impact on the profession in a certain way, whether it's through their practice, it's through teaching, it's through research, and it requires years of ongoing dedication to these efforts. And they also need to be recommended by their colleagues. So it is considered a mark of honor or distinction to be given the status of the Fellow of the American College of Physicians, which you will sometimes see physicians list next to their name as FACP. Or if it's a surgeon, it's FACS. Now the question is, does being a fellow of any of these societies, has there been any kind of research that shows that it gives you an advantage if that letter writer is someone that you've worked with? And we don't have any evidence to suggest that that is true, but please keep in mind that we do have evidence of other distinctions among letter writers that are received very, very favorably. For example, if somebody is a faculty member at a medical school, or if they are a core teaching attending at a residency program, or they hold a certain title, whether it's clerkship director, social program director, or program director, those titles are received very, very well. Now, the one thing to remember about letter writers is a stellar letter written by someone who doesn't carry a title like that is going to be better received by programs than a mediocre or generic letter written by somebody who has status. That is a very important point, take-home point to keep in mind. Let's shift to ARAS experiences. Lots of questions about ARAS experiences, understandably so. One of the questions is in the experience section of ARAS, what are the experiences that can be mentioned? And also, what would be a good way to represent our hobbies in this section? So just about any experience can possibly be mentioned. And certainly ARAS provides some categories of experiences for you to consider, whether they're work experiences, research experiences, volunteer service or advocacy, education and training, military service, other extracurricular activities, clubs and hobbies, professional organizations, and teaching and mentoring. So there's a plethora of possible choices in terms of what experiences to list. We will talk a little bit more about that in a moment, addressing the second part of the question, which is what's a good way to represent our hobbies in this section. If you so choose, you can make one of your experience your hobbies. Now, must you do that? You don't have to do that. In the previous versions of the ARAS application, there was actually a section there for hobbies and interests. That isn't the case now. Now it's up to you whether you want to include it. But what I would say to you is this: seldom do programs look at hobbies and say, oh, somebody has a certain hobby, we must absolutely interview them for that reason. That is not a common thing that happens. Hobbies are generally things that people pick up on as sort of a place. Let's say that you're interviewing with a program. They may start your interview by talking about your hobbies as a way to make you relax, get you comfortable, break the ice, so to speak. But a hobby in and of itself, again, unless it's extremely notable, is not going to earn you an interview. And so I want you to look at your hobbies in the context of everything else that you've done. And if there are other things that you've done that are much more compelling, and remember, the number one thing that programs are looking for is evidence that you are going to be clinically capable, that you have the potential to be a successful resident. And that can be communicated in many, many different ways. So there may be experiences that outweigh your hobbies. And so you have to kind of make a judgment call on how your hobbies relate to all the other things, the many other things that you've done. Now, another question was how to select 10 experiences and the most meaningful. So the way I advise people to figure out which experiences to highlight is to make a list of all of your experiences. Be all inclusive. So you can obviously start with your personal CV and make a list of all your experiences from that. But I want you to dig deeper because we meet a lot of applicants who don't include everything in their personal CV. So when you're thinking about what experiences to share with a residency program, list everything you can, even if it's not in your CV. Then once you have your big list, it's time to decide which 10 that you can feature. Remember, that's the new part of this application. In years past, you could list many, many experiences, but now you have a maximum of 10. So once you list all of your experiences, you ask yourself, do you have more than 10 experiences, which some applicants have, and then do you have less than 10, which some applicants also have less than 10. Now, remember, it's not always about quantity. It's really about quality of experiences as well. So if you're somebody who doesn't have 10, all is not lost. It's about the quality, the depth of what you've done. And if you're struggling because you're worried that you have less than 10 experiences, you can always reach out to me and we can kind of talk about how you're feeling and what you've done, because I'm often able to pinpoint some strategies to help you if you're concerned about quantity. Now, if you have more than 10, what I want you to do is I want you to think about which of those 10 are going to be most appealing to the programs. Now, obviously, you're also going to think about what's most important to you. So it really is a balance between what's important to you and what's appealing to programs. But sometimes applicants tend to lean more towards what's most important to you. And that's when you can run into a little bit of trouble. Because at the end of the day, you're trying to communicate the vital information that increases your chances of getting an interview. So I tell applicants we need to strike a balance, but we always have to have an eye on, is this going to appeal to those programs? Now, for those of you who have more than 10 experiences, there may be situations where you want to lump a few activities together in one experience so that you can showcase those different events. Now, as far as the meaningful experiences section, when you are deciding which one of your experiences goes into the most meaningful experience section, you have to ask yourself, why was this section created? The reason it was created is it helps the programs better identify applicants whose backgrounds and interests better align with their mission. That has to do with the concept of fit. Fit is very, very important to programs. So that's what you have to kind of think about as you're deciding which 3 of the 10 are going to be your most meaningful. Moving on to program signaling. So those of you who are just learning about program signaling, this is a very powerful technique that we have at our disposal to net ourselves interviews. This is one of the most important parts of the residency application. It requires a lot of thought, a lot of strategy, and a lot of research of programs. We did have a rotator who asked us, what is your recommendation for the best program signaling strategy? Now, it is challenging to generalize this to all applicants because people have different needs. And so based upon what your needs are, your signaling is going to have to be adjusted. But we can make some generalizations that would apply to many IMGs. So what I tend to tell people to do is to first make a list of your IMG friendly residency programs. I know all of you are feverishly working on that. Some of you may be done or close to being done with that. And so keep working on that. That is a huge part of this whole process. Now, once you make a list of IMG friendly residency programs, you want to shorten that list even further by looking at the programs and their criteria and considering how their criteria match with your profile. And by your profile, I'm referring to your step scores, your year of graduation, the nature and amount of your US clinical experience, your visa status, whether the program has taken residents from your school or your home country, and if they are IMG friendly, just how IMG friendly are they? Are they a program that just takes maybe 10% of their residents as IMGs, or they have 60 or 70% of their residents being IMGs? So you're going to factor all of this into your decision making to whittle down that larger list of IMG friendly residency programs into a smaller group. From that smaller group, you want to now start to think about which programs are you going to signal. And you only have, in most cases, depending on your specialty, a handful of signals to give. So each signal is incredibly precious. Now, as you're trying to figure out from that smaller list which ones to signal, you've got to factor in other considerations, like your geographic preferences, like your network. Who are the people that are in your network, and what do you know about the programs from those people? If you talk to a friend or an alumni of your medical school who's at a particular program, and you're able to find out that that program isn't that big in the signals, you may not want to signal that program because you can save your signal for another program that the signaling means a lot more to, and you can use the contact in your network to advocate for you at that other program. So there's a lot of this type of thing that needs to be thought of as you interact with your friends, alumni, and other contacts at different programs. We don't want to waste our signals. There is strong evidence that programs heavily factor your signaling. So examples of how people can waste their program or waste their signals are when you select too many programs that are what we call dream programs where you'd love to be at. And maybe they have taken an IMG or two, but maybe your criteria or your profile doesn't match up very well with that criteria. Now, I'm not saying you can't use a signal on a dream program, but using your signals on too many dream programs cuts down on your chances of getting interviews from the limited number of signals that you have. So we don't want to signal programs with a poor or haphazard manner. Geographic preferences. We did get a fair number of questions about geographic preferences. One of the questions was phrased as such: how to navigate when choosing geographic preference? Should we choose areas or have no preference? So let's look at a little bit of the data and see if that can guide us. And again, it's hard to generalize this to everybody because everybody has their own unique situations. But in 2022, we know that 2/3 of applicants for internal medicine, I'm going to use internal medicine as an example, indicated at least one geographic preference. And my feeling is that this year, a higher percentage of applicants are going to signal a geographic preference. Now, over 70% of internal medicine programs used geographic preference in the selection of residents. So these are the programs that you have applied to. Over 2/3 of these programs are using this to help select their residents. Now, how do they use this information? They use it in many different ways. And I've just put up here on this slide just a few ways that they use it. So if they're doing an initial holistic review where they are factoring in everything that you've shared with them, they are using geographic information along with other aspects of your application to decide whom to interview. When they have many qualified applicants, and perhaps the number of qualified applicants exceeds the number of interview spots that they have, they may use geographic preference as a tiebreaker. So those applicants that are sort of equal in their profiles, the tie may be broken for those who have a geographic preference for that program's location. They can also use geographic preference as a screening tool, just like programs can screen applications using other criteria, like step scores, for example. They could also use your geographic preference to screen and basically narrow a large volume of applications into a much smaller number, which then receives a more holistic review. Whatever they do to use this information, one thing is for sure: a large percentage of programs felt in internal medicine that the information supplied by the geographic preferences helped them to identify applicants that they might have otherwise overlooked. That is a very, very important point. So to take a step back and to kind of tell you why we are where we are today with geographic preferences and why it's in the application and so important, we know for many, many years that applicants who match, when we ask these applicants through surveys, what are the factors that you used to rank programs on your rank order list? At the top of the list is geography. So even before geographic preferences came into existence, programs were looking at applications for any evidence of your geographical ties to their region. They just didn't have the geographic preference section at that point. So they were looking at everything else that they could see. So that could mean where you did your rotations or what your address is. So where you went to college. So they were looking at everything to decide on your geographic ties. Now, the reality of the situation is geographic preferences ties is not perfect, right? There's a lot of people that can be potentially overlooked if you're only using geographic preference. But since they know that it's so important to applicants, they feel that this is something important for them to use in their decision making. And for us, it's a chance to not be overlooked. So in terms of when you're deciding whether to identify some geographic preferences, you have to factor in how the programs view geography. Another person asked, should you apply to programs outside your geographic preference? Is it worth it? So what we know from the data is that applicants whose geographic preferences align with the program's location, they were invited to interview at higher rates than those who reported no preferences or those whose preferences were misaligned. Now, there are some programs that, as you can see from the data in the previous slides, that don't attach as much importance to geographic preferences as other programs. Therefore, if your profile fits with the criteria of the program located in a region that you did not indicate as a geographic preference, it still would be reasonable to apply to that program. We have a number of questions asking for advice on how to stand out in this whole process. One of the questions was, how do you stand out with your application? Another person asked, what are the factors that can make or break your application? So now, standing out with your application means optimizing every aspect of your application and every aspect of your candidacy. So now what that means is there's some basic things that make sense but don't always happen. And that includes things like submitting your application on time. Everybody understands that that's important, but in reality, many applicants don't have everything ready to go on time. And if you can get this one thing done, it will significantly enhance your chances of getting interviews. And that means not just submitting the application on time, but having a complete application at the time of submission. Everything ideally in order, whether it's your application, whether it's your transcripts, whether it's your letters of recommendation. If everything is available, then programs can act on your application and make decisions that hopefully will be in your favor. And you have that advantage if everything is done on time and complete. Following directions. This sounds obvious, but you would be surprised how often applicants don't follow directions. Doesn't matter if you're USMD, DO, or IMG, we see it all the time. There are a lot of things that programs can ask. Sometimes those things are apparent on their website. So if they ask you for some supplementary materials and you don't submit them, then you're probably not going to get an interview. Sometimes they're very specific about what they want. Sometimes they come right out and say, in your personal statement, we want to know why you're interested in training in the state of Oklahoma. If you see that on that program in Oklahoma, if you submit to them a personal statement that doesn't address what they're looking for, chances are your opportunity to interview goes way down. So we have to follow directions. We need to make sure that every aspect of our application is in tip-top shape. So we need to make sure that our ARAS application is written in a compelling way, especially the experience section. So the experience descriptions, the impactful experiences, your reasoning for why you've picked certain geographic regions as your preferences, all of this needs to be done very, very well. So the content has to be there, and it has to be written in a manner that is attractive to them. So again, that is a central part of standing out. It also means that we have to make sure that our strategy is sound when we submit our application. So if you have an area of concern in your background, the so-called red flag, we have to make sure that you think about how you're going to present that. Are you going to address that in your application? That depends on the nature of the red flag. But in many cases, it's to your advantage to address it in your application. Some applicants have the belief that I'll wait to address it when I get to the interview stage. But programs may not grant you an interview because they're concerned about whatever that concern is. And so addressing it in your application is generally the best way to put your best foot forward. If anybody is concerned about any red flags that they may have in your background, I encourage you to reach out to me directly and we can talk about it. A personal statement that's powerful. We want to make the reader feel something about ourselves. And we want them to say, I really need to meet this applicant. You can do that through your personal statement. And remember, the personal statement is a factor, an important factor in making interview decisions. We know that 70 to 80% of programs, and sometimes higher percentage depending upon the specialty, will look at the personal statement when making interview decisions. So creating something that really speaks to them is crucial in this process. And then letters of recommendation. We need to do everything we can to help our letter writers write the strongest possible letters of recommendation on our behalf. Now, obviously, a large part of that comes from our performance in a rotation or in a research experience, but many letter writers are very open to having us provide some input. So I encourage all of you to read the letters of recommendation chapter in the Successful Match book, which most of you have, and if you're a new rotator, you'll be getting very, very soon. But read that chapter because it will show you how a student or an applicant can work with their letter writer to bring forth important information that allows a letter to be more impactful. Your letter writers want to do a good job for you, and it's our job to partner with them to do that. And there are other things too that will make you stand out. These are just some examples, but this gives you a lot of food for thought. We had some questions about step scores. One rotator asked, is it wise to apply to programs that require no attempts on step exams when you have one attempt on step? So in other words, if you have failed an attempt, should you apply to programs that say we only want to look at people who have passed on their first attempt? This all depends. I can tell you many, many examples of people who have received interviews and matched at programs where they didn't meet the criteria. Their profile didn't fully meet their residency program criteria. And sometimes that means their step scores don't meet the program's criteria. It could be that they have failed an exam, or it could be that they have a score that's lower than the cutoff score that's published on the program's website. And I have seen people match at those programs, but it is program specific or program dependent. Depends upon the rigidity of the program's leadership and their overall philosophy. But exceptions are made, and it's not uncommon. And why do people make exceptions? Why do these programs uh, break their rules? Because you're bringing something else to them that they really covet. So even though you may have struggled on a step exam, the step exam doesn't define us as the type of physician we're going to be, right? We can be a great physician even when we've had difficulty with a step. And programs know that, but they use the step exams because it's easier for them to narrow this larger applicant pool into a smaller number. So if you've had history of step difficulty, what you want to do is really highlight the other aspects of your candidacy that you would bring to a program that would show them that you're this well-rounded person who has the potential to make some strong contributions because you've had that track record before. And when they see that, they're going to see you as somebody who would be a great addition to their program. So highlighting your other areas of excellence is an important part of overcoming a step attempt or a low score. But networking also plays a factor here as well. So when they hear from somebody that they know that you are somebody that has a lot to offer and that you should not be completely judged on your step exam, that makes a big difference. That can have a very powerful effect on your consideration by a program. Now, remember, the reasons why we may have had trouble on a step exam, they're varied, but sometimes these things are not under our control, right? We got sick, we had a major family issue. These are things that programs can understand. Again, if you address it in the application, and if you have somebody advocating for you, that helps as well, because it brings your application to their attention. And if they're filtering applications, it takes you out of the filter and lets human eyes examine your application. Questions about when to apply. Somebody asked, is it okay to apply late for residency, say in November instead of September? So your best chances are always if you apply before the first day that the programs can download your application. So applying in September is the best policy. I realize that people have different situations and they might be inclined to submit their applications later, say in October, November, even December. Programs do have varying deadlines for consideration of applications, but even if their reported deadlines are in November or December, the problem with this approach of applying late is that you assume that there are some interview spots still remaining. And since most programs extend the bulk of their interview offers in the months of October and November, applying late really puts you at a disadvantage because you may be vying for very few spots among the applicants that are left, or you may be reaching out to them at a time when there are no interview spots left. So it's always better to apply in September. Another rotator asked, what is better? Apply now with a low step 2 CK score, or wait and get a better one and apply late, or apply next year altogether? And this particular rotator indicated that he or she was a recent graduate, having graduated from their medical school in 2022. So basically, this rotator is asking which one of these three options is the better option. So your highest priority is doing well on your step 2 exam. Now with step 1 being pass fail, programs essentially only have one data point that everybody has in common. That's our step 2 score. Know from surveys of program directors after step 1 went pass fail that the step 2 exam is now the most important factor when programs screen applications. So that priority needs to be on doing well on your step 2 exam. That means not rushing this exam. Your path to getting into residency is always going to be easier when you have a higher score. And so in order to achieve that, oftentimes what we need is the benefit of time. Now, how much time we need obviously varies from student to student and from applicant to applicant. But I highly encourage you not to rush this, to take this exam when you feel well physically, emotionally, and mentally, and the evidence indicates through your self-assessment exams that you are tracking to perform at the level that you hope to achieve on the real exam. I know people are worried about YOG. I can tell you all kinds of examples of people who get to where they want to be with varying YOGs because their STEP exam score was higher, and it made the process of getting noticed a lot easier. So remember, graduation date, nowhere near as important as your Step 2 CK score. Visas. So we had some questions about visas, one of which was, can you please clarify what it means when programs state, we accept ECFMG sponsored J1 visa? If programs sponsor visas, what does ECFMG sponsored means? So as you have all seen, most residency programs offer J1 visas. Fewer and fewer programs are offering H1B visas. Now, J1 visas are sponsored by the ECFMG for the purpose of IMG's in clinical training programs, in residency programs. The ECFMG is the only sponsor for J1 visas for residents in clinical training programs. So if you're seeing language as we accept ECFMG sponsored J1 visas, that I know can be a little confusing, but essentially when you match into that particular program, you are going to be getting your J1 visa sponsored by the program, and that is the case for all J1 visa granting residency programs. Another question about visas is, what's the best way to talk about visas during the interview? So for those of you who are visa requiring, there's a lot of questions about visas and your status, and you need to know this information, and the programs need to know too, these considerations as it relates to you. Now, when you're in a residency interview, at some point the interviewer is going to say, do you have any questions for me about our program? Your first questions should not be about visas. They should be about the program, the curriculum, the culture of the program, other aspects of the program. That is always the better way to start your questioning of the interviewer. Now, you don't want to ask visa questions to every interviewer. The right people to ask are generally the program director or the program coordinator. They will be most knowledgeable about visa-related issues. I sit on our residency selection committee at Baylor, and many of my colleagues are not that familiar with visa-related issues. But I can tell you our program director is extremely knowledgeable about it, as is our program coordinator. So these are the types of people that you want to ask. Now, you can acquire information about visas even in advance of your interview. So many programs have sessions, right? We talked about the virtual open houses. We talked about the meet and greets. So any sessions that you have before you apply for residency or before you interview, you can potentially ask questions about visas at those sessions. And on your interview day, there are programs that will also have specific visa, sessions for visa requiring applicants. I know at Baylor, when we were, for example, doing in-person interviews, we would always have a session for IMGs so that they could meet with our program personnel who were extremely knowledgeable about visas, and they could ask all of their questions. And we still do that today, even in our virtual format. Another question had to do with, does choosing a J1 visa instead of both J1 and H1 visa while filling out the ERAS application, does it increase the chances of getting interviews as a G? So with fewer and fewer programs offering H1B visas, this is really not an issue. We had some questions about pre-match. Question is, how do we apply to a pre-match program? Is this only after September 27th, or can we contact them now and seek an offer? So each pre-match program operates differently. The only way to know is to visit the program and look at their page on how to apply, and they generally will spell out what their process is. So again, this is program dependent. So make your inquiries with programs if you can't find the information you need on their program websites. And remember, the application dates and deadlines vary, and how you exactly apply and what format, whether it's ERAS or something else, that also differs from program to program. Some programs actually have their own applications. So make inquiries with the individual programs so that you don't miss out on anything. And this is the time to do that as you're researching all these programs. We had questions about research. One question was, if my application seems research heavy, what can I do to cater to community programs? So we do have a fair number of applicants who have a rich background in research. Perhaps they are now transitioning back into the clinical arena. They want to get into residency, and they're worried about how their immersion in research can affect the way in which they're viewed by community programs which may not be research oriented. So what you're trying to do here is trying to show, again, fit with community programs using the opportunities that you have available to you. Some of those opportunities include things like your personal statement. So some applicants will write one statement for more research-oriented programs, and they will write a different statement for those programs that are more community-oriented with less research opportunities. You can also carefully craft your ERAS experiences to balance your research experiences appropriately with your non-research experiences. So again, this can be related to the number of experiences you choose to include as research experiences. So there are ways to de-emphasize some of the heavy involvement in research through how you craft your ERAS experiences. Now, your choice of meaningful experiences has some bearing on this as well. Remember, 3 of the 10 experiences you can identify as meaningful experiences, and you have to decide whether to include research experiences among those 3 or highlight something else if you feel that your chances of matching to community programs is a lot better than research-heavy programs. Somebody else asked, is it okay to write about research where I am a 6th author? It's an abstract in ASH. First of all, congratulations on having this abstract in this very prestigious society. Absolutely, yes, it is okay to write about this project in your ERAS application. Remember, for those of you who are published, those of you who have presented your work at conferences, it is an accomplishment to get any sort of work published or presented, regardless of where you are on the author list. You being able to bring your work to publication or presentation is something notable. So that is something that should be featured in your application. If you are somebody that hasn't got your work to publication presentation, because it takes time, right, to get your research published or presented, do not fret. You can include your research projects in your ERAS experiences. Residency programs value research that you do, even if it doesn't lead to publication. Should we include submitted papers, abstracts in our CV? The answer is yes. You can designate publications as submitted, provisionally accepted, accepted in press. If you choose not to do that, you can also put it in your research experience. So let's say one of your 10 experiences in the ERAS application is a research project. You can indicate there also that you have submitted your paper to a particular journal. Is it possible to compensate for lack of publications with a well-rounded CV and high scores to match in academic programs? And the answer is yes, because what we said before, the #1 priority of all programs is determining whether you will be a successful resident in the clinical sense. That means that you can perform well, taking histories, performing exams, presenting patients, and documenting the encounters in the EMR. That's the bread and butter of what you do every day. And there are obviously a lot of qualities that you need to be able to demonstrate to do that work well. So the #1 thing that programs are looking at, are you going to be a clinically capable and successful resident in their program? Now, it is true that research is part of the mission at academic programs, but it is nowhere near as important as your clinical work, and it does not override your ability to do great clinical work. So if you've been doing great clinical work and there's evidence of that through your application and your other application materials, whether it's your letters of recommendation, that is something that's going to be noted by both community and academic programs. Now remember, those of you who may not have had a chance to establish an area of excellence in research, and maybe because of that you lack publications, you may have distinguished yourself in other ways. And that may include things as community service or volunteerism. It may include things like advocacy. You may be a dedicated teacher and have made notable contributions to the education of others. Perhaps you have been leading mentoring efforts. So you have been involved in different things. They may not have been research, and that is going to be noticed by programs. At Baylor, where I work, and many university programs where I have colleagues, we look at all of these things when we're trying to make a determination of, is this person the type of person who would succeed and be a good fit in our training program. Questions about applying to multiple specialties. Somebody said or asked, can we apply to 2 specialties in the same hospital? Yes, you can, but there can be some problems with this approach. Remember that programs in all specialties prefer applicants who are committed to their specialty. You will see that in the NRMP surveys done of program directors, where you look at the criteria commitment to specialty. And you'll see that that is a highly rated criteria when making interview decisions. And they want to ensure that you're committed to their specialty because they are counting on you to be a resident, to complete your training at their program. You're a vital part of their program. You are important to the patient care they deliver. And obviously, you're part of their workforce along with the faculty and other personnel. And they would rather not have you leave because you like another specialty better and you find a spot in a different program. Even worse, we have situations where somebody matches into a specialty, it's not their preferred specialty. In fact, they may not even like the specialty. And because of their dissatisfaction, they perform poorly. And that, of course, creates all kinds of problems for the program. So no program wants that type of situation. And when you do apply to 2 specialty, logistically, it can be complex. There's always a threat that you could be found out by the institution or the programs at that institution. And that, of course, could prevent you from getting an interview at either program when you apply to 2 specialties at the same hospital. Letters of interest. The question is, can we start sending letters of interest now that express interest in a program and in the hopes that we are considered for an interview? So in late August, the person is wondering, if I send a letter of interest now, can I get consideration for an interview? And it is true that some applicants do this. And a potential advantage to doing this is that you're sending this interest at a time when programs are receiving far fewer communications from applicants than they will receive after September 27th. So the chances are that it could be noticed. But the problem is, what action can they take? Because they don't have your application. They don't have a means, usually at most programs, to track this type of communication. And so you could send this email and it may not be very fruitful. In my anecdotal experience, when I've seen people do this, have I seen any results from it? Occasionally, but it's not going to be a very high yield from reaching out to programs and program directors at this point. You may say to yourself, even if I have a tiny chance from some success from doing this, I'm going to give it a shot. And I wouldn't argue with you on that, but I would not go into it thinking it's going to pay off in a very, very big way. If we should wait until after programs start downloading applications, how long until we can start sending letters of interest? So ideal situation is knowing when the programs will start to send out their interview invites. And more programs are starting to share this information. So we're calling upon programs to be a bit more transparent. We have a long way to go. But when I speak at different medical schools, at different residency programs, one of the things that I am encouraging our professions to do in different specialties is to be more transparent. We need to tell our applicants a lot about our application process so applicants can make good decisions. One of which is, when are the interview invites going to be sent out? So you're starting to see some more programs include this on their websites, but we're not where we need to be. But if you can determine when this is going to happen, either from their program website, from friends or alumni of your medical school, contacts in your network, virtual open houses. Sometimes you get that information from going to a virtual open house. If you get that information, then you can time your letter of interest to arrive after you apply but before those interview invitations are sent out. That will help prevent you from being filtered out. It will help you get maximum consideration for your application. So that is what I would advise you, is to try to time your communication to the best of your abilities. Of course, most interviews are given out in October and November, so that also can guide you on when to send letters of interest. And our final questions have to do with the residency interview. So we're going to shift now in just a few weeks after we apply into thinking 24/7 essentially about the residency interview. So questions that we got related to that is essentially, how do we prepare for residency interviews? So I would highly recommend that you start by looking at the 150 plus pages of detailed interview prep in our book, The Successful Match. So almost all of you have it. If you don't have it, you'll be getting it soon. But start there. There's a lot of detailed information there. There's chapters on how to prepare winning answers to high yield and common questions. We also have on our website, thesuccessfulmatch.com, a lot of blog posts about the residency interview that complement what's in the Successful Match book. We're not able to update the Successful Match book as fast as we can update the blog, so this complements the book. So go to the blog and search residency interview. You'll see articles of all sorts, one of which lists hundreds of the most common residency interview questions, but categorizes them into groups so you can see how questions are related to one another, and this will cut down on your interview prep. So this is one example of a very high yield article that I would highly recommend all of you go and read. We also have on the Successful Match website a podcast called Success in Medicine, where we've actually devoted episodes to aspects of interviewing. In some cases, I've taken a question and gone into length about how to answer it in an optimal way. As I mentioned at the beginning of this talk, if you stay with us for these Residency Real Talk webinars, starting next month and in the months of October, November, we will devote almost the entire episode to residency interviewing. We'll take your questions. Sometimes I will pretend to answer questions. So there'll be a lot of great info that will come from those forthcoming webinars. There is a residency interview course that we have created. My partner and I, Dr. Kata, and myself have gone into a very extensive residency interview course, which includes before and after videos of applicants answering most important questions with modules on how to take your before answer and make it a very compelling after answer. So that is available at thesuccessfulmatch.com. And I believe that all of these resources are chock full of information that will get you to where you want to be for your residency interview. But I know that some of you like to have one-on-one coaching with me directly. And so I do have an interview coaching or mock interview service for those of you who feel that that's important to you. So you're always welcome to do that with me as well. And so that brings us to the end of this PowerPoint presentation. We covered a lot of things, a lot of great questions. So I'm going to hand this over here now to Alyssa.
Yeah, that was great. I think we were able to answer pretty much every question that we got. So that was great. So I'm just going to go ahead and start to conclude our webinar for the night. I just want to say thank you to everybody who joined us tonight, those who are returning, those who are first time. Thank you so much for joining us. Also, I wanted to throw a thank you out there to all of those who ended up submitting a question on our Google form. We really appreciate the participation on that. And, you know, we're always thrilled to see you guys interacting with us and sending us questions. So if there's anything that you want to hear about or would like to hear in the next upcoming webinars, please let us know in the chat. We would love to hear you guys' feedback and opinions. We hope that this webinar was useful and that we were able to answer most, if not all, of your questions. And I did want to briefly reiterate that you are part of our MD2B Connect family. So please do not hesitate to reach out to us if you have any other questions that we didn't answer tonight, or if you'd like to discuss them privately or separately. Please feel free to reach out to any of us, including Dr. Desai. We would be more than thrilled to help you with that. One last thing is I will be sending out a recording of this webinar later this week. So please keep an eye out for that. You know, for those of you who joined late, or if you just want to rewatch it, that will be available for you at any time. So thank you once again for joining us and for spending your time with us tonight. Any final remarks, Dr. Desai?
No, I'm going to echo what you said, Alyssa, that I don't want anybody to feel like you can't reach out to us. We want you to reach out to you. If you haven't figured this out already from what Alyssa and I are saying, we love to hear from you. We want to support you. And that's what being a part of the MDDB Connect family is all about. So thank you for joining us today and for your great questions. And again, wish you all the best as you move through this process.
Yeah, and I just want to mention too, if you guys have questions, please, you can reach us anytime at info@mddbconnect.com. You're also welcome to reach out to myself, Dan Morris, he's our Director of Client Services. I'm sure that many of you have worked very closely with him, including Dr. Desai. So thank you all so much for your time, and I hope you all had a great time and hope you have a great night.
Take care. Have a great evening.
Bye, guys.